So in our previous episode discussing rotational sport athletes, we said that the foundation of a lot of these injuries actually comes from the core. So I wanted to dig a little deeper into the anatomy. So the anatomy of some of these issues actually starts with the transversus abdominis. That is the internal back belt of the core. We start to see a breakdown or basically a loss of control of some of these muscles, and it actually starts to create stress into the disc. The disc is that kind of cushion that sits between the vertebrae. It doesn't mean you necessarily have a disc bulge or herniation, need to run and get an MRI, but there's instability in this segment that actually causes an irritation of nerves and then causes this cascade of effects. Well, some of those could be nerve pain, glute or lower back pain, muscle strains. So digging deeper into kind of that disc is really a high concentration of water content. So when I see a lot of vulnerability, or when my patients say that they're worse, they're in a state of dehydration. So there's certainly things that you can do to start to build things up. But first and foremost, muscle is the biggest shock absorber to these structures. So we have to actually start to coordinate and condition some of these muscles to help you be less vulnerable to injury.